Trudy sitting in for Elias, getting the latest from Dr. Chris Labos on this listeriosis outbreak. Dr. Chris Labos is a cardiologist with a degree in epidemiology and is a regular contributor to CJAD 800. Good morning, Dr. Labos.
Good morning, Trudy.
So give us the background on this particular case of contamination with listeria. Certain plant-based milks, there was a big recall, a lot of coverage about it earlier this month. Have we been learning about more cases of illness?
Well, I think the number of cases has plateaued for the most part. I haven't seen reports of new cases. There were 2 deaths associated with it, and so some of the people who were initially hospitalized did ultimately pass away. So I think it underscores that, while the total number of cases was small, obviously, food contaminations, food poisonings like this are not benign issues. I mean, people died. 2 people died because of it, and it just goes, I think, to the importance of food safety and why it's important to, treat our food properly and realize that even things that we, assume are safe can potentially be the subjects of contamination, and that you have to be a little bit careful and you have to be, pay attention to when these food recalls happen, because if you consume a contaminated product, you can get sick. And while, with listeria, most people who are infected with listeria will recover, there are a number of people who won't and who will get more severe disease, land in hospital, and in tragic cases like this, sometimes die.
In previous coverage of other listeria contamination cases, it always seems to me that the big ones involved meat products. We had, I think it was the Maple Leaf case. There have been a couple out of the U.S. as well. That's why I was kind of surprised when we started talking about this case, because it was plant-based milks. They were only certain types put out under the brand name Silk and Great Value. How does that type of contamination tend to happen in a plant-based milk?
Yeah, so you are right. When you usually hear about listeria, you usually hear it in terms of animal products. We would typically see it in dairy products. Milk was often a source of contamination. We don't see it much anymore in milk for the simple reason that we pasteurize our milk, right? So that kills off most of the bacteria. You will occasionally see it in soft cheeses or when people use unpasteurized milk to make certain brands of cheeses. So you see it in those circumstances. But a bacteria is a bacteria. A bacteria is around. It can inadvertently get introduced into any food product. So as a result of, manufacturing, packaging and all that, you can always introduce a bacteria to a food. I mean, we often think about salmonella associated with chickens and eggs, but it can infect anything. And so because a lot of our food is manufactured and processed elsewhere and then shipped closer to us, the possibility to have a contamination, to have a contaminant at any point in the food distribution system is a very real one, which is why, that's why the Canadian Food Inspection Agency exists, to test these products, to identify when there's a source of contamination, then coordinate the recall. So in some respects, this is the system doing what it's supposed to doing. It's just that you ideally want to get the recall done before, many people get sick and before somebody dies.
Yeah, 12 cases of listeriosis confirmed in Ontario, Quebec, and Nova Scotia, 9 hospitalizations, and those 2 deaths that you mentioned. And I think the plant is in Ontario, is it not, that manufactures these? I think I remember reading that earlier, that manufactures the products.
I was trying to look into that, and I couldn't actually find a lot of the details. And it's very possible that we'll never find, the exact cause. I think the presumption is that there was something that happened during the manufacturing, especially when you have such a widespread situation. It's usually a central plant where all the products are then shipped locally that, is usually the source of the introduction of the contamination.
So what does this bacteria do in the human body?
So it's a bacteria. It causes an infection. In most people, it's going to be a mild self-limited illness. It's going to cause fever. It can cause gastroenteritis. So for many people, they may just feel a mild gastro. What's dangerous about listeria is that if you are older, if you are immunocompromised, potentially if you're pregnant as well, it can enter into the bloodstream. It can cause a more disseminated infection, and it can even spread into the central nervous system and cause meningitis. And so that's the real danger, is that not if you have the mild infection, which you will clear on your own, is do you have the more severe form of the infection that's going to require antibiotics and going to land you in hospital. And again, if you get prompt treatment with antibiotics, you probably will recover. But if you're an older individual who has underlying health problems and you're very sick and it takes a while for you to get to the hospital, that's how the infection can sort of get the upper hand. And, it's often what happens is that the infections will then lead to a series of complications. You can get, damage to your kidneys, your organs can shut down. It can cause a series of downstream complications that are, difficult to manage in hospital. And this is where people end up with severe complications and end up passing away.
I wonder if this is, since the pandemic, I think our thinking has changed about going to the hospital. I'm not going to the hospital. A, the wait's going to be too long, and B, I'll pick up some bug there, and it'll be even worse. So people might have dismissed this as just a tummy bug. Oh, I ate something, didn't agree with me.
No, you're very right. And you know what? It can be very difficult to know if something is a severe case or not. I mean, the general recommendation is, as much as, the emergency rooms are crowded, as much as we tell people, don't show up for minor illnesses. Honestly, if there's a doubt in your mind about the severity of illness, it's always better to present and get sent home than to not show up at all. Because especially with, cardiac issues, it's rarely, obviously people show up to the emergency room thinking they have chest pain, thinking they're having a heart attack, and it's not a heart attack, and that's fine. But where the real problems lie, the real problems are people who wait at home for too long. And if there's a mistake that happens consistently with regard to cardiac care, it's people waiting at home too long when they're having a heart attack because they think that chest pain is something else. And I imagine, similar things happen with other issues, right? I completely understand why people are hesitant and reluctant to go to the emergency rooms, especially with the wait times being as long as they are. But if there's a doubt in your mind, it's always better to play it safe and go. And worst case scenario, you'll get sent home. It's just that unfortunately the wait may be very long if you're not having an acute illness.
I think in some people too, there's a certain amount of how do you put it? I think there's a certain amount of shame, to go, oh, yeah, I'll go to the ER complaining of chest pains or complaining of a tummy bug, and they're going to tell me I'm obese and I need to lose weight, or I haven't been taking care of myself. I should drink less, or,
Yeah.
And it'll end up being, this angst-ridden experience for nothing.
Yeah, and I completely sympathize and I understand, and, many people may not. It's certainly understandable why a lot of people find going to the hospital frustrating. What I would say this, though, as frustrating as that experience might be, as unpleasant as it might be, as unsatisfying as it might be, because you may not get a definitive answer, you may get told, well, you're not dying right now, please go home and follow up with your family doctor if you have one. You get that type of response, which can be very frustrating for people. But what I would say, though, is that what the emergency rooms are for, what their core responsibility is to deal with emergencies. So if you have appendicitis, if you have, a bad infection that is split into your bloodstream, if you're having a heart attack, if you're having a stroke, if you have an abscess somewhere, you are going to get the care that you need, and you are going to get it quickly and definitively. And so because it's difficult for you as an individual to know, are you having a heart attack or are you just having chest pain? The only way you're going to know that is to go to the emergency room. And, it'd be nice if the answer came to you in 1 hour as opposed to 12 to 14 hours. And hopefully we can fix that in our healthcare system. But that still is the right approach to make, because the consequences of missing a heart attack are much more than the inconvenience you get from waiting around to see a doctor when you're not actually having a heart attack and you're just having a little bit of indigestion.
Quick question for you, Dr. Labos, before we go. Please, this from a texter, please ask Dr. Labos, how long does it take for listeriosis to declare itself after, I guess, you consume the contaminated food?
Yeah, it'll take several hours. I mean, if you drank the contaminated food and, a day or two has passed and you're fine, you're probably not going to get sick. You should be able to see the symptoms, fairly quickly. It's not something that, if you drank something a few weeks ago, you're not going to get sick now at this point. It is a fairly rapid process.
Dr. Chris Labos, thanks very much for that pep talk for people who really should go to the hospital and not hesitate. I appreciate that.
My pleasure. Take care.
Dr. Chris Labos is a cardiologist with a degree in epidemiology, and you hear him regularly here on CJAD 800.